Hello and welcome to Rise YouTube channel. My name is Zibudh Shah, and in today's deep analysis video, we want to discuss on this article. The article titled Joy and Pain. The article which surfaced in today's Hindu newspaper, that is 2nd of June, editorial section, where we have identified some key ideas and other key facts which are important for UPSC CSE exam. And from that, we had made a exclusive content for you so that you are able to answer all those demands of the question if a question is asked from here directly or indirectly. So our article's title is NFHS-6 dated 2023, Joy and Pain in India's Public Health Transition. The second part, where this article is going to help me, to be very specific, it will help you in social justice and governance. And third, before starting the topic, we must have a clear picture of how a question can be framed from this topic so that we get a better clarity or a better picture about the article. So before starting the article, I will read a model question for you. It is NFHS-6 reflects both achievement and emerging vulnerabilities of India's public health transition. Examine the key health gains, emerging challenges and policy measures required to ensure a sustainable demographic transition in India. 15 marks GS2 social justice. Okay. Once done, we have seen where it will help us, the idea behind framing the article and the question. Now let's just get started with the real content, the real idea. We will discuss this article onto few bases. First, we will have a brief introduction about the article. The second, what were the key highlights, that is in sense of good highlights, joyous movement, as the article suggests, joy and pain. We will first discuss the joy, then we will discuss the pains in the article, the pain in the survey report, its implication, its way forward, and a conclusion. A very specific UPSC content. At start, if we see the introduction, it says it says whatever the title of the article. It says NFHS-6 reflects a mixed picture of India's healthcare system. Major gains in multiple sectors like maternal child welfare, along with some challenges, rising challenges of lifestyle disease and aging. It somewhere highlights India's transition from infectious disease and undernutrition to a dual burden of malnutrition and non-communicable disease. In the article, we have given a complete idea of the topic so that whenever we are writing an same introduction in our answer copy, the examiner gets a clear picture of what we are going to write in the body. Second, the joy, key health gains, what we have achieved. In the sector of maternal and child healthcare, we have increased the institutional deliveries from 88.6 to 90.6%, to be very precise, a 2% increase, which indicates a safer childbirth, reduced maternal and neonatal mortality, and a stronger healthcare access to all the citizens of the country. Under the same head, we get to see antenatal before the delivery. The registration of antenatal has increased to 95.9%. To be very specific, in first trimester, it has increased from 70 to 76.2%. The next, we get to see a demographic stabilization, where total fertility ratio is stable well below the replacement rate of 202.1. We are at 2, exactly 2. It reflects the demographic maturity of women, due to women education and reproductive awareness among the women and family, among partners and family. Third, nutrition gain. As we have seen, we are not now under nutrition. Stunting had reduced from 35.5 to 29.3. Severe wasting has reduced from 7.7% to 5.2. It somewhere indicates that improved nutrition delivery, that can be due to midday meal and other PDS system, maternal care, and better child development outcomes, which again indirectly have an effect on the labor productivity, which we'll see on later phases. Next, we have also done remarkable work in immunizing expansion, immunizing the mass, where we get to see fully vaccinated children in the age of 1 to below 2 years. We have achieved from 83.88 to 87.1%, which again strengthens and prevents healthcare and reduces vaccine predictable diseases. The diseases like rotavirus or those diseases which can be prevented due to this vaccine will be reduced because of the growing numbers of vaccine immunization. Rotavirus vaccine coverage, we have increased that from remarkably from 36.4 to 85.4%. It's a major success, reducing diarrheal diseases burden on children mortality. And on the same head, we get to see public healthcare role has also somewhere played an important role in immunizing. We have immunized 95.6% through public's facility itself, which again reflects a strong state-led healthcare delivery system and trust of public and citizen to its institutions. The last point, financial protection and social inclusion. We get to also see there has increase in health coverage from 41 to 60%. You might be wondering how this is helping or have a good impact. We are somewhere promoting less out of pocket expenditure through this health coverage. Those people, those 60% citizens who are covered into this scheme through private or government scheme, ensures that their out of pocket expenditure is reduced, is minimized. Schemes like Ayushman Bharat reduces catastrophic healthcare expenditure, as I was speaking, a public healthcare system, a scheme launched by the government. And at last, we also get to see, as we were speaking, the total fertility rate has reduced, is at 2% or 2, way below the replacement rate of 2.1. The achievement here has an effect of women internet use. We get to see there is increasingly decreasing of the digital divide between genders. Earlier, which 33, one third women had access to internet, now it is somewhere around 65%, which again narrows the digital divide and improve access of information, autonomy and governance participation, which again indirectly or directly helps their education and knowledge ability. Now, after seeing all the positive outcomes, what are the lacunas, what are the pains that the article is talking about? First part, in the introduction only, we have seen there is increase of dual burden of malnutrition, where we get to see undernutrition coexist with obesity and metabolic disorder. And even this obesity is not divided equally among gender. We get to see the effect of obesity is more to women than men. The data is in front of you. It speaks women's obesity has increased from 24 to 30.7%, and men's obesity has approximately increased from 23 approximately to 27%, which again indicates that there is a lifestyle link problem in the generation which India is facing currently. Second, we also get to see that there has been decline in exclusive breastfeeding because of changing lifestyle and new opportunities. We get to see the rate has declined from 63.7 to 55.8%, which again reflects that the infant is more prone to diseases, infection, and weakness can arise more frequently, because we get to see we have a traditional idea and a scientific basis of that. The more a child is on breastfeeding, it gets more immunization. The next part, we also see a rise of C-section deliveries even when it is not required. Therefore, we also get to see the rise in the percentage from 21.5 to 27.2%. It somewhere indicates that it over medicalizes the procedure whenever, even if it is not necessary. Unnecessary surgical intervention is taken in place. Normal delivery is not being practiced. It is somewhere affecting the health of the mother. And at last, it somewhere weaks the non-communicable disease preparedness. Sample registration system and national health account shows inadequate focus on metabolic disorder, and health spending remains curative rather than preventive. Even in today, we are spending more on curative measures rather than preventing measures, which is again exploiting the fact that India is not prepared or inadequately prepared for non-communicable diseases. Now, after we have seen the joys and the pains mentioned in the article, now let's see its implication. What are its implications? The first implication would be on the aging population challenge, where we get to see we are below the 2.1% of replacement rate. At the same point of time, longer life expectancy may increase the demand of geriatric care, pension, and healthcare spending, which will again show in out of pocket expenditure. The next, the data which shows there has been weak preparedness for non-communicable disease. We see a rising burden of non-communicable disease in the system, where obesity, we have seen it has risen, indicate future surge in diabetes, hypertension, and cardiovascular disease, stressing the healthcare infrastructure. Third, threat of demographic dividend. We know we are at the peak of demographic dividend. We are now having a positive effect for the demographic dividend, but because of this obesity or lack of nutrition, as I was speaking of in the positive or the joyous part, poor workforce health can reduce productivity, rise absenteeism, and weakening economic growth. Again, a productive labor and a healthy labor will always result into economic growth in long term, and a weak labor force and an unproductive labor force will always have a weakening effect on the economic growth in long term. The household financial vulnerability. If this kind of diseases persist, we will get to see in near future there would be rise in long term treatment costs due to lifestyle changes, due to all those diseases, non-communicable diseases, which are increasing in today's population. And at last we also get to see its impact on the systematic reorientation of health system, where health care must shift from maternal child and infectious disease focus towards preventive and chronic care model. Again, the same thing, the same idea, that the system should not focus on curative measures. It should always focus on preventive measures so that we are able to protect our workforce better and manage them so that we get the maximum benefit of our demographic dividend and economic output. At last, we have seen all the problems now. Let's just now discuss about the way forward. As we have seen the joyous part, the negative loss part, and its implications, now let's see what are the way forwards for it. The first would be preventive screening, so that at the earliest stage a disease can be identified and cured, so that again we are stressing more into preventive rather than curative stage. Example, universal screening of diabetes, hypertension, cardiovascular disease for early diagnostic and better result. The next would be not only changing government policies and health structure will not play. A change in behavioral should be placed in form of behavioral change communication, where there should be promotion of healthy diet, exercise, exclusive breastfeeding to reduce the disease in infants through mass awareness campaign. Third, there should be also a fiscal deterrence be in place, so that all those factors or all those products which have a positive effect on the non-communicable disease, means which expands or increases the non-communicable disease, should have a fiscal barrier attached to it, in sense of increasing taxes on sugary beverages and ultra processed foods to discourage unhealthy consumption. There should be 3-tier healthcare system in place to expand the NDC management from Ayushman Arogya Mandir to tertiary hospital through referral system, where the lower rank, the primary health system, should deal with all this non-communicable disease, and at the upper rung, the tertiary sectors, the super specialty hospital, should deal with the chronic problems, so that there is better management of crowd and patients. Sustain existing gains, like ensure no slippage of immunization, maternal care and nutrition services. We should expand its horizon. And at last, there should be an evidence-based governance, where we should use continuous data from NFHS, so that targeted intervention should be in place. Efficient resources can be done with allocation and regional planning. At last, if we now move into the conclusion part, we will draw a conclusion which will again complement my introduction. The conclusion is like, NFHS-6 is both a scorecard for India's public success and an early warning system for future vulnerabilities. India must sustain the maternal child gain, while at the same point of time it should also move towards or pivoting towards preventive, NDC centric, non-communicable disease centric, and a lifestyle healthcare system for healthy longevity and a healthy aging. With this, I would conclude today's video or session. I hope today's session was helpful for your preparation. And after this session, you are now able to answer this question in a more holistic manner. If this session was indeed helpful for your preparation, I would like you to subscribe to RiceEye's YouTube channel and like this video. And I would also like to inform you that the detailed PDF or the detailed content which we have studied now is available in the RiceEye's website. So, thank you.